couple of healthcare news items here before we head back to the phones. First up, the Rand Corporation did only 1/3 of Obamacare exchange signups were from the previously uninsured. Only 1/3 of exchange signups were previously uninsured. Now, the Rand study hadn't been published yet. Its contents were made available to the Los Angeles Times. The Rand survey estimates that 9 million people have purchased health plans directly from insurers. The Rand survey estimates that 9 million people have purchased health plans directly from insurers outside the exchanges, but the vast majority of these people are already insured. So, Obama's sitting there saying, oh, yeah, we're the only country that... We're not doing anything that this law set out. It's a mishmash. And from the National Center for Public Policy Research, 3.1 million young adults have not received coverage via their parents' insurance. Now, this is one of those big deals even the Republicans say they can't oppose. I had two things the Republicans say about Obamacare. There are at least two. That we can't repeal. No matter what, we can't do away with them, and we're not going to do away with them. One of them is coverage for pre-existing conditions. We're not going to touch that. Everybody wants that. Everybody wants everybody, no matter what their particular. But pre-existing condition insurance is not possible. It's not insurance. It's something else. And if you call it something else, you might change the percentages of people that support it. And that's why they call it insurance. Well, I think everybody ought to have insurance. I don't think having insurance ought to be denied anybody when it comes to health care. Of course, everybody thinks that. But then what if you're talking about offering people something that isn't insurance, but is in strict definitional terms welfare? Well, then what kind of support does it get? See, that's the kind of stuff that matters to me. It makes me, a stick in the mud. Let's say you decide, for some reason, you have enough money, you don't have to get a mortgage. So you don't have to have homeowners insurance. So you don't. You plop down whatever your house costs, and then one day you drive home and you see smoke coming from your neighborhood. And you get closer and closer and you see it's your house on fire. Oh, my God, oh, no. Then you realize, you know what, I don't have any insurance. So you call the insurance company and say, hey, my house is on fire. About 20%'s destroyed. I want homeowners insurance. And they would tell you to go pound sand. You got to buy the insurance before the fire. Now, if you want the insurance company to pay you or to pay for the repairs the fire caused, you're not buying insurance at that point. You're buying repairs. Now, the equivalent, you decide, because you're young and healthy, or take the risk, whatever, that you're just not going to get catastrophic health insurance. You've got enough money to pay as you go when you go to the doctor, this or that. And then you do go to the doctor and they come out and they say, you know what, you've got X terminal disease or X catastrophic disease. You go to the doctor and they come out and they say, you know what, you've got X terminal disease or X catastrophic disease. You call health insurance. I just was diagnosed with, but I want insurance. Sorry. You can't get insurance for something that you should have bought insurance for this before this happened. Well, I want it now. Well, no, we don't sell that. That's not insurance. But we are a compassionate country, so we're calling that pre-existing condition insurance. But there really is no such thing. It isn't insurance. It's something else. And if you termed it something else, would it have the universal support that it's got? Is your children being covered by your policy until they are 26? That's Not going to change. No matter if we got our arms around Obamacare, we're able to get rid of the whole thing. We're not getting rid of that. Well, the National Center for Public Policy Research has done some research. I mean, that's what they do. And they have found that the number of young people who can now stay on their parents' insurance plan until 26, the slacker mandate, we call this. Spoiled kids who don't want to pay their own way until they're 27 stay on their parents' insurance, but only 3.1 million young adults have not received this coverage via their parents' insurance. Well, here's the pull quote. And this gets into the weeds here. It's a little deep of analyzing that. The whole story does. But here's the upshot of this story. What HHS did, Health and Human Services, what they did amounts to little more than a back-of-the-envelope calculation. To really get at how many young adults are newly covered under their parents' policies would require surveys asking very detailed questions about the source of insurance. It would also probably require more sophisticated statistical analysis. As it stands, all we have is an estimate of the number of young people who got coverage via their parents. It's an unreliable number. It's far too unreliable. This story says for major newspapers to be reporting it. And the Health and Human Services has not updated their figures in nearly 2 years. And the reason is the program is losing its effectiveness and the numbers are declining. There aren't that many kids staying on their parents' policies. There aren't that many kids up to age 20. It's something that's not being utilized. There's no way of determining it. There aren't that many kids up to age 20. It's something that's not being utilized. There's no way of determining it. There just isn't enough statistical analysis and data for people to figure out how widespread the benefit is. And the best that they've been able to come up with here is, despite what Obama and the LA Times and the media is saying, there are 3.1 million young adults who have not received coverage via their parents' insurance. David Hochberg is the story. He's a PhD. And it's another lie about Obamacare. It's the point of this little research project is to say that this magic of all these kids being covered, they're not, is the bottom line. It's just a feel-good talking point. And your parents, your kids are going to be able to stay covered on your policy till they're 26, but it's not happening, as best anybody can tell. Here